Let's hit it.
Hi, everyone, and welcome to Alzheimer Speaks Radio. I'm your host, Lori LeBay, and I'm so excited that you're joining us today. We are going to have a fascinating conversation, as usual, as we learn from people all around the world at all ages and stages of life. Stay tuned as we shift our dementia care from crisis to comfort.
Here we go. What you think about, you will bring about.
Hi, everyone. Welcome to Alzheimer Speaks Radio. I am your host, Lori LeBay, and I hope you enjoyed our opening music. It's called Clarion Call by the Mark Arneson Band, and feel free to download that on any of your favorite music channels. For those of you that are new to our show, Alzheimer Speaks Radio has been around for about 10 years now, and we're about sound information, not just sound bites. We want to raise all voices all around the world who are dealing with dementia. Today, we are going to be talking about speech therapy, but before I do that, I just want to give a shout out to Artist Senior Living of Wilmette in Illinois. I'm going to be doing a caregiver survival camp, which will be a virtual webinar Tuesday, March 23rd from 5:30 to 6:30, and anybody can register for that. Just call 224-408-3152, or you can go to theartistway.com/Wilmette events and find more information there. Also want to shout out to the Memory Cafe directory if you're looking for a wonderful support group where both the person with dementia and directory.com, and then of course Dementia Map, our global resource directory, which we just launched right before the new year, and I'm so proud of how that is growing. But there's lots of great information out there, and if you have a service, product, or tool and want to be part, please feel free to reach out to me for more information. And then Choral Health, I always like to mention, they're allowing people during COVID to still download two of their music apps, Music First and Choral Faith. And you can go ahead and just go to choralhealth.com. That's CORO health.com. And last, I want to invite you to Arthur's Memory Cafe. We do that the second and fourth Wednesday of each month at 1 o'clock. Which is virtual, and again, you can reach out to me for more information on that. So let's get to our guest. I am thrilled to be talking today with Dr. Kelli A. Uitenham, and she is a nationally certified speech and language pathologist. She is the owner of Serenity Speech Therapy, which is a private tele-practice company. And Dr. Uitenham is a medical speech and language pathologist who specializes not only in young adults, but adults and geriatrics. She works on treating articulation, cognitive and swallowing and fluency, as well as voice deficits. Kelli has worked in skilled nursing, assisted living, as well as independent living communities. She has experience as a travel speech and language pathologist and is licensed to practice in 7 different states, providing telehealth. She also has access to the Speech Easy wearable device for persons who stutter, as well as Speak Out, which is a provider that helps people with Parkinson's. So Kelli, I am so excited to have you on the show today. I think this is a really important topic. So many people, I think, don't understand about speech therapy. So again, thank you for taking time out of your day to be with us.
Thank you so much. I'm honored to be here.
Well, I think we're going to have a fun and interesting conversation and hopefully open some people's eyes. Now, before I started my line of questioning, I always like to ask every guest if they have been personally touched in their own family or circle of friends by dementia.
I have not experienced the personal touch of dementia with anybody in my immediate family, but I do end up forming a very strong connection with my patients. And so I do treat them like family. So I believe that it touches my heart in a very, very similar way.
I love that you treat them like family and touches your heart,
Oh,
because I think
yes.
that's the main point of our connections. The depth is what really matters. Why don't we start out with telling our audience what the heck is speech therapy?
Yes.
Because I think so many people don't really, they know the term and they like, well, okay, it has to do with my language, but they really don't know specifics.
Yes. It's very common for when I was seeing patients in skilled nursing facility or anytime in person. It's very common for patients to tell me, nothing's wrong with my speech. I don't need speech therapy. But speech therapy is a very vast profession. So a lot of times people can associate that with a pediatric speech therapist. I am a medical speech therapist, so I deal with adults. Speech language pathology is, I'm going to read the definition from ASHA. We work to prevent, assess, diagnose, and treat speech, language, social communication, cognitive communication, and swallowing disorders in children and adults. And it's the cognitive communication disorder part that often brings me to my patients who have dementia. And that can lead to swallowing disorders because, of course, swallowing is controlled by the brain. So we work with our patients in that regard. I always say that my scope of practice is here and here. And so I put my hand above my head because that encompasses the brain, and then mid-chest level to include voice and swallowing.
Okay. And I think that, the swallowing piece, so many people don't understand. And yet it can become a big issue with many. In fact, I just had somebody from our memory cafe, and they had to have a speech therapist do an evaluation of their loved one because she needed her medications either crushed or liquid, and they wouldn't cover the cost unless it was prescribed and said, no, this is a physical thing. She's not faking it. And so there's so many of those things that come up with people on that. What are some of the benefits that you can provide to a person, living with dementia and their family?
Well, as we know, dementia is a progressive disease. And so including or incorporating speech therapy can help to slow the process because going through graduate school and even, part of my doctoral studies, the brain still is, of course, it's still functioning, but, those cells are dying. And so exercising the brain, cognitive challenges, the things that they may experience, word finding issues, of course, memory issues, sequencing, problem solving, all of those things are taken into consideration. And the goal for speech therapists is to slow the process of dementia and help the person who has dementia to maintain their independence as long as possible. And also, it's widely beneficial to the caregivers because, of course, there's caregiver burnout. How do you communicate with a person with dementia? What can you say to keep them as happy and maintain their quality of life or improve their overall quality of life? And caregivers are a big part of that.
Thank you. I think that's a really good thing to include kind of the family and how it supports them, because this really is a team effort in terms of just getting us to be able to communicate, or when it comes to feeding as well, in terms of being able to get that nutrition in and down. So important. What are some of the misconceptions that you hear people have about what it is you do and how you do it?
Common misconceptions are that I only work with children, and oddly enough, I don't work with any children. Another misconception would be that I only address talking or speaking, and I just think that a huge misconception is just the lack of knowledge. So they don't know that I address cognition, the way somebody thinks, word finding, if someone's having a tough time, like they know what they want to say, it's on the tip of their tongue. The voice aspect of it, there are just parts of speech therapy that are not listed in the name. And so a lot of people don't know to consider those things when talking about this profession.
Exactly. I think it's funny when you say only kids, and I think people think, well, maybe if somebody has a stroke, but there's so many other elements that can come into play. And a person with dementia isn't limited just to dementia. I mean, they could have a stroke, they could have all, brain traumas, they could have all different types of situations that might cause a need to tap into a speech therapist. And so I think that that's really important. Same with the care partners. If they're having a difficult time, that's going to, with their word find or their cognition or their tone of voice or whatever it might be, that's going to make it more difficult for the person with dementia to understand what they're saying too. So this isn't a one-sided thing. This is just in terms of opening up communication so that we can all be the best we can.
That's right.
In those circumstances. Now, is there a certain type of dementia diagnosis that you see more often than not?
I see a lot of Alzheimer's, of course. It's rare to see like a Lewy bodies dementia or a vascular dementia, but I do see quite a bit of Alzheimer's, and that is also a misconception. People think that the two are completely different. Dementia is an umbrella term, and there are different kinds of dementia that are underneath that umbrella term.
What about, a symptom of aphasia? Can you explain what that is?
Sure. So aphasia it literally means without words, losing part of your language. And so that was, I kind of touched on it when I said, if you feel like the word is at the tip of your tongue, then it's there, but you can't come up with it. That is a kind of aphasia with word finding. But there are different kinds of aphasia where you may suffer a stroke and you feel, or the person with the person with aphasia believes that they're communicating effectively, but they're not. And so we call that expressive aphasia. So if someone is trying to say, I really like your blouse, it could come out, and for them, that truly is them saying, I like your blouse. So that can be extremely frustrating when you're trying to express something to somebody, you're trying to communicate and you can't. And then you also have to consider, if someone has to go to the bathroom, or if they're in pain, or if they're hungry, or they don't like the meal or beverage that they're provided with, how are they going to communicate that to a caregiver or a loved one? There's receptive aphasia. So you're speaking clearly to a person with aphasia, but they can't understand what it is that you're saying.
Yeah, I know we had a real dear friend who had aphasia, and her words were just all jumbled. And it was amazing how, she would stumble and pause and say her words, and yet it forced you to pay attention. And it was kind of like reading a sentence that shouldn't make any sense, but the words, or putting a word together and everything's jumbled and you just, what it is. And I found when I slowed down, when I was just really present, I could still figure out what was being said. And yet it's scary sometimes to people to hear that and go, oh my gosh, what's going on? And they're just like, it's so different, and they push away, and just the fear that people feel about that inability to speak how we once did. And yet, I found that you could do it if you just turned off everything else in your head that was spinning around.
Yes, yes.
And then, you pull in kind of the body language and things too. Can you give us any pointers in terms of if someone's having trouble with word find? Because I think probably everyone listening is going to have to admit that they've had problems with word find at one time. Are are there different games or, techniques that you can engage in to help with that?
Absolutely. The very first thing that I like to do with my patients who have aphasia is automatic speech. So if you think about singing a song or counting, saying the days of the week, the letters in the alphabet, all of those are automatic speech. So that means that you've said them so many times, you've repeated it so many times that you could wash dishes, do the laundry, make up your bed, and vacuum, and still be able to do those things and not think about it. It's completely automatic. So starting with the alphabet, that's easy. And then you increase the challenge level progressively, the better that they get at it. A lot of times I like to incorporate things that are functional for my patients. So if they love gospel music, then I will play a song that's slow enough for them. A lot of times it's Amazing Grace. A lot of times I've got patients who love Johnny Cash or the Motown hits. And so I will play songs from their era, and that's automatic speech, because if it's a favorite song, then they know it. So you can drive and sing your favorite song and not even pay attention that you know every single word. It's automatic to you. So that's one. And I also incorporate, if it's a patient who was a mom or a wife and a homemaker, then I'll include telling them to find different words or starting with a specific letter, and tell me all of the groceries that you may find in a market that start with this letter. And so you're building on things that are important and functional to them while kind of making it fun and a game.
Okay. One of the things I wanted to mention when you brought up the music, because I do hear some people go, I can sing it just fine, but I can't speak it just fine. And what's behind that?
So there's a technique called melodic intonation, and that includes the musical piece for the word finding and the automatic speech. It kind of ties it all together, if that makes sense.
Okay. Because you hear that even with singers and stuff. They'll say, I'm really shy, or I stutter, or people who do stutter, which can be a problem too. And some people don't stutter, and then all of a sudden that becomes an issue. And I would imagine that might be out of just self-consciousness of, am I going to make a mistake if I've got dementia, and then there's more fear in that. And then sometimes I would imagine that makes you spin in a whole nother cycle. Do you find that at all?
I have treated a patient who had dementia-related stuttering, and that led me to discover the Speech Easy. I am a Speech Easy provider I'm in the Charlotte, North Carolina area, Charlotte and surrounding areas. The Speech Easy is a device that you place in the ear. It's a wearable device, and it uses the choral effect. And so in persons who stutter, if you speak in tandem with them, like if you read along with them, whether it's a story or a Bible verse or anything where you can read at the same time as them, that tricks the brain into thinking that it is that it doesn't need to stutter. And of course, the brain is a very complex piece of the body and constantly being studied, but the choral effect is something that works to significantly decrease and in some people stop stuttering. And the same thing works when you sing.
Oh, interesting. I had gone on your website and I saw the Speech Easy, but I didn't really know what that
Yes.
was. So when you say it's the choral effect, is it like playing their voice in their ears so that they don't?
Yes.
Okay.
Yes. So the device actually looks like a tiny hearing aid. There are 4 models, and they're pretty discreet. So, if you are wearing a hat or you have, your hair down, then it's very difficult to see, but it uses the person's voice to echo what they're saying.
Okay.
And so it sounds like someone is speaking with them at either at the exact same time or with a slight delay, and the stuttering stops.
Okay. Are there techniques in terms of when people are doing word find where, maybe they had a large vocabulary and they can't do as many syllables to tell them to, maybe find a simpler word? Does that ever come into play? Like I said, I know nothing, so my mind's just out there.
So finding synonyms for words that were more complex and they want to use a less complex word.
Mm-hmm. I don't know I don't know if that would make it easier for them to speak, or if that's adding more to the process of trying to spit something out.
In terms of someone who has a large vocabulary, I have worked with people who are like public speakers or held some sort of office, and they begin having an issue with word finding. I incorporate the words that are functional and important for them. So I'm not going to have somebody who used to drive for a living, working on words that a politician would use. So each of my programs are really tailored specifically to what the patient needs, their backgrounds, their interests, what's going to make it easier for their family or their caregivers. So if it were an issue of a more complex word versus a more simple word, I would want to know if that's what the patient wanted or if they want to continue to use the larger words. And if that's the case, then I would definitely create a plan and come up with activities where they would be able to hold on to that or rebuild or regain some of the things that they've lost.
Okay, good to know. I wanted to also touch on swallowing. Are there like physical exercises to get people to swallow, or?
Absolutely. Yes. So swallowing, of course, is controlled and completed with muscles. And as we get more seasoned, I don't like to say older, as we get more seasoned, our muscles can atrophy, they can get weaker. And, just like any other muscle in the body, if it's weak, you can do exercises to strengthen it. The same with the brain. So you can use your tongue to do those exercises. You can actually use the weight of your head as an exercise, lifting it off of the pillow if you're laying on the bed. There are several techniques that have been studied and incorporated into speech therapy, but yes, I do provide, in some cases, quite extensive exercises to strengthen those swallowing muscles.
Okay, great. Now I want to talk, COVID's probably changed everything around for you in terms of
Yes.
how you serve, from being in person to going virtual. Can you tell us kind of both sides of the coin, what life was like before and what you hope maybe it gets back to along with the COVID conversion in terms of treatment?
Yes. Before it was, you get that human connection. And, if someone's having a tough time, whether it's completing the activity or if they get tearful, which, it's common, you feel like, I know that I can do this. I used to be able to do this, and I can't now, and I need help. So that can be very overwhelming because you think it's so simple. It's so simple to, to swallow this applesauce or to come up with 5 different animals, and they're struggling with it. So if they become tearful or emotional, being able to rub someone's back or hold their hand or pass them tissue, that's the human connection that I absolutely miss. Because now it's, you could do those things, but are you putting yourself at risk? Are you putting the patient at risk? And just that fear has absolutely changed the way that therapy is done. You have to think about the people who are hard of hearing. So you have a mask on, you're trying to explain to them what you're doing, and then they're getting frustrated because you have a mask over your face and they can't hear you very well. So those are some pros and cons of being in person during this time. The video, the tele-practice side of it, you don't get that connection. Like if they're upset and, needing a tissue or, just a physical connection of a touch hand to hand or that's tough. But if they have, a child there or a caregiver who can offer that human connection, that's amazing. But with the telepractice side of things, it's absolutely the safest, I think, at this time.
Yeah. Maybe you tell them to have a box of Kleenex, and then if they get teary and don't want to grab one, you can pass them one through, and
Right.
they can pull one up, and maybe get them to laugh, a little bit too.
Right. I do virtual high fives, which I think helps to keep them engaged and excited and give themselves a pat on the back for doing a great job.
Well, that's good. That's good. What before COVID, did people come to an office, or do you go to their home, or how did that work?
So before COVID, I was still seeing people via tele because I have 7 state licenses, and so I see people across the country. To physically see people here in North Carolina, I would go into skilled nursing facilities, assisted living facilities, independent living facilities, and be in their home, in their space, and do therapy that way. But I've always done both. And so now I'm just only doing tele.
Okay. And for a session, how long does that typically run, just for a per session? And then, if you can kind of give us an idea of how long a therapy would last. And I'm sure that varies depending on each person and their situation.
Yes. Okay, let's see here. Therapy sessions, again, I tailor mine specifically to what the patient needs, and really what they can do. So, when I was in person and in SNFs and ALFs, ILFs, it really was based off of like what they could handle. So it could be anywhere from 15 minutes to an hour. So I always say I'm here to help, not to hurt or hinder. So if there's a patient who is just not having a great day, they may have been up all night. They may have had an episode where they, had a tough situation with a caregiver. They didn't want to do something and, they're just exhausted. They're spent from the evening before. Well, I'm not going to make somebody address something that could already be challenging and frustrating for them for 45 minutes. So I will do something functional with them, and then I could add a longer session the next time that I see them when they're feeling better and more up to it. On the tele side, my sessions are typically 30 minutes. If the family and the patient are for it, then we can do anywhere from 45 to 60 minutes. And I base my frequency, how often I see them, off of their comfort level. So I can do anywhere from 1 to 5 sessions a week. And that's also based on insurance and private pay. Okay. So with insurance is going to reimburse a certain amount of sessions in a certain amount of time. And if you're private pay, then I'm really able to tailor it to what that patient or what that family wants or needs.
Okay, that was going to be one of my questions in terms of insurance. And I would imagine that they have to first get referred from their regular doctor over to you. Yes. For that coverage, kind of the normal process when you're pulling in a specialty person. Yes. Now, one thing that we didn't mention was what states you're in. Do you want to go ahead and plug those so people know where you're licensed in?
Sure. I am licensed to practice in North Carolina, California, Virginia, Georgia, Florida, Indiana, and Massachusetts.
Okay, that's quite the variety there.
Yes.
That's a lot of licensing to keep up with.
It is. But that was one of the joys of doing travel therapy, all the licenses. So I knew I was going to do teletherapy with my private practice. So I just kept them all and I've been able to use them, which has been great because I've been able to help so many people during the pandemic.
Oh, that's fantastic. Now, do you find many families reaching out individually, or do you find most coming through, their insurance plans and through their doctors?
So far, it's been them finding me on their own through Google or word of mouth, actually.
Isn't that interesting?
Yes, it is. You do all this work to get panel with these insurance companies, and they find you on their own anyways, organically. I love it.
Well, I think that has something to say about our medical system as a whole. I know I'm trying to get into a specialist, and they're like, well, we're booked out. It'll probably be 3 or 4 months before you can even get an appointment. And
Oh
I mean,
God.
it's nothing major, but it's like I can see where people would just give up and go out on their own and start searching around and stuff too. Especially when it comes to something like this, like communication is so vital in
Yes.
terms of who we are and our feeling of feeling part of. It's just it can affect so many other aspects of our health.
Oh yeah.
From depression and anger, and I mean the list goes on and on and on. And everybody deals with those factors differently, so that can trigger other things from maybe somebody drinking or taking medications to offset what they're feeling if they're not finding a way to try to deal with this. And so
Absolutely.
I would really encourage people, if they have any question, push the doctor, get that referral, and if you can't get it from one, you go to another one. you know
Absolutely.
and people dealing with dementia are used to that, sad to say, but they need to have somebody who understands the needs instead of, oh, this is just part of the process.
Yes.
Yeah, it's part of the process, but that doesn't mean that there can't be improvement along the way and that there
That's
can't be support. And there's nothing worse, I don't think, than having that feeling of, oh, we should have tried that.
yeah. Yeah.
Because then
I
you carry that guilt around of it could have been different. And you don't know for sure, but I think it's kind of human nature that we let that inner critic beat us up.
Yeah, yeah. I always say people don't know about speech therapy until they need speech therapy. And addressing those things that you just spoke on, depression and how important communication and language are, there's a whole profession that is dedicated to helping to improve those those deficits when they arise.
Well, yeah, the self confidence, and when you don't feel self confident, then a lot of times you self isolate and pull back, and I mean it can be a nasty spiral, and then all of a sudden you're like, well, how do we get here?
Yeah, yeah.
It's because
And I would
nobody wanted to address it.
Yeah, and I would say for people who notice a change, don't ignore it because because um, people with dementia, some of them are phenomenal maskers, and that term to mask, it means that they're essentially covering up their deficits. So it could be them creating a joke about it, um, just trying to jump in or make light of whatever situation. If they're constantly losing their keys or talking about a topic that was um, closed out and moved on to a different topic 15 minutes ago, but they're still on that topic because that's what they remember. Um, and if you do bring it to their attention, like mom or dad or auntie, whoever, we already talked about that. Well, they're not going to say, well, I've been having a really tough time with my memory and I'm just trying to get in where I fit in so I sound natural and can still be included and participate in the conversation. They're going to mask it and create a joke about it. So I would say just keep an eye out for loved ones. If their behavior has changed in any way, it's always better to be safe than sorry, because I run into people who do say the, should have or I didn't know. So investigating and taking those things very seriously are very important.
Yep. Well, and anytime there's a change, we should be noting that, and we have to. I think sometimes, I know, even going to the doctor with my mom, who lived with her for 30 years, sometimes you can make a comment, you can say it, but it's also in how we say it and the urgency we put behind it in terms of what we're saying. And I know as a care partner, sometimes we don't want to see it. We're doing our homework and we're saying it, but we don't really want to go down that path either, because we're uncomfortable with it. And so
it's scary.
Yeah.
Yeah.
So we all have to get better at that, for sure. I wanted to ask, in terms of your telehealth sessions, what kind of response are you getting from both a person, let's say, with dementia and just patients in general, in terms of how they're feeling in terms of dealing with the technology?
They love it, actually. They don't have to deal with traffic. They don't have to worry about the weather. They just need the good Wi-Fi connection and their computer, and they're good to go. The people that I see that do have dementia, they have a spouse or a child who's with them that can help them navigate. But that's also, part of the functional therapy. So part of the therapy is remembering, how do you find the end button? How do you log off? And where do you look for the camera? If I have them write something down and I want to see it, I'll tell them to put it up to the camera. At first, it can be a little tough because they're holding it off way to the side and I can't see it at all. But they have assistance. There is assistance typically with those who are in later stage dementia and require that assistance.
And I will just add, a lot of people with no dementia at all have issues with holding stuff up to the camera as well. So
those actually are able to follow the directions of how to find the camera lens easier than my patients with dementia.
Well, it's funny because so many people that I work with dementia, they've been doing Zoom and video conferencing for years. And they said they've actually had an easier time adapting to COVID than a lot of other people. And so they've been teaching them how to use it, because that's really been their lifeline in so many cases, where friends and family have pulled away, or maybe they're not able to drive and get around like they used to. And so they really rely on this. And I think getting people to access this technology has really been a very empowering thing for many. And it's fun to see the pride of, oh, we can do this, because the fear was so strong. It kind of makes me think back to when computers first came about and you were scared to death that if you pushed the wrong button, everything was going to flatline on you. And
that's right.
And I think with so many people, they have that premise of that's what it was like. And so they're just, off to the moon. So, I'm a big advocate of telehealth. I think there's a lot of pluses with this in terms of convenience and stress. And I think back to even with my mom with dementia, she would get stressed out going to the doctor. And so you'd tell her and she'd have to get ready. And that whole time she'd be like, what's wrong with me? That's where her mind went all the time. And to just be able to pop her in front of a computer, she wouldn't have had that build-up time, you know, to think, oh no, what's wrong?
Yeah. I also like that, help is a click away. So with my patients, it's, you can contact me if you have a question or if you're concerned or if you need to change your appointment or, it's so convenient and it's so instant. This is very much a time of instant gratification. We've got Amazon Prime and you want something, it can be at your door tomorrow. You don't have to leave the house. And so, now speech therapy can be brought into the homes of people who need it instantly. And I love that.
Yeah, that's absolutely fantastic. Well, first I wanted to thank you too, because you are part of our Dementia Map Global Resource, which I just think is so cool, because I think, our goal is to bring all different types of resources to people. And I think sometimes there are things that people don't even know that could help. And so I'm thrilled that you're part of that with us. But how can people get in touch with you? What's the best mode
They can always visit my website, which is www.serenityspeechtherapy.com. And my phone number is there. They can reach out to me through the contact links at the bottom of each of the pages. Always they can call. Their doctors can fax. My fax number is there. They can email me at info@Serenity Speech Therapy. And my phone number is 828-548-3155. And they can use any of those to reach out and communicate, as well as my social media. The Facebook account is Serenity Speech Therapy, as is the Instagram account.
Yeah, I love the consistency. Not everybody has the consistency of what it is. So, yeah, reach out to Kelli. And I love how heartfelt you are. You treat your patients like family, and you really custom design to meet their needs. I think that's so important, to have that true patient-centered, relationship-based care, to understand if someone is having a difficult time, or if they can push it a little bit further in terms of what are their goals and what are their wishes there. And again, this isn't just for dementia. All ages and stages of life can need speech therapy. So just know that it's there, and it doesn't have to be scary. And you can find a fabulous person like Kelli to work with. And my gosh, she's in 7 states, so there's lots of people. And as far as insurance or private pay, that's something that you guys can discuss. This has been really helpful. Kelli, is there anything that we haven't talked about that we should mention?
I guess just a little bit more on the swallowing piece, just how important that is, as along with oral care. Listening to your loved ones is very important. So if they're complaining that, it hurts to swallow, or their food is uncomfortable, or if a pill that they're taking, they have a stuck sensation, all of those are things that speech therapists can address as well.
Wonderful. And again, very important things to know, because swallowing is not something that you want to play around with there, and you want to catch that as early as you can, I would imagine.
That's right. Deficits with swallowing can lead to pain and discomfort, a disinterest in food, which can lead to weight loss, malnutrition, dehydration, and of course that can lead to urinary tract infections, and all kinds of health complications that we do not want for our loved ones.
Exactly. Well, again, Kelli Uitenham, thank you so much for being with us. I really appreciate your time. And again, for our audience, you can go to serenityspeechtherapy.com and get all your contact information, and go ahead and connect with Dr. Kelli. So again, thank you so much for your time today, Kelli. Appreciate it.
It's my pleasure. Absolutely honored. And for those who do reach out and go to the website, please know that consultations are free.
Wonderful. Oh, good to point out.
Yes.
Free is always good. That's for
free is a favorite. Yes.
Yes. We should have started with that.
I should lead with that. Free consultations.
Yeah. Well, again, thank you all for listening, and I hope you like, click, and share this with others, so speech therapy isn't a secret any longer.
Hey everybody, Jared Sebestier, host of Retire Repurposed. This podcast is dedicated to help people transition into fulfilling and purposeful retirements. Retirement is a big life change. In fact, the 2 most dangerous years of a person's life are the year they were born and the year they retire. Few people can just flip the switch from working a career 30 or 40 plus years, retiring on Friday, without methodical steps to living what we call a repurposed retirement. To listen now, search Retire Repurposed on your favorite podcast platform, Senior Resource, or Life Audio.